Hello there. Recent research has challenged traditional estimates, suggesting that nearly as many females as males may have autism. In fact, almost 80% of autistic females remain undiagnosed by the age of 18. For adults, an autism diagnosis can be early, providing an explanation for long-standing symptoms and opening doors to essential health resources and support. Uh, in individuals assigned female sex at birth, identifying evidence of autism can be challenging for several reasons. For example, masking. Females with autism often develop coping mechanisms that mask their symptoms, such as mimicking social behaviors they observe in others. This can make their condition less apparent and lead to underdiagnosis. Different presentation. Autism may manifest differently in females than in males, with females exhibiting social behaviors that are more in line with social expectations. This can lead to misconceptions about how autism presents in females, making it less likely for them to be diagnosed. Misinterpretation of symptoms. Certain autistic traits in females, such as intense interests or repetitive behaviors, may be mistaken for personality traits or attributed to other conditions, leading to a misinterpretation of symptoms. Gender bias. Historically, autism has been studied and diagnosed primarily in males, leading to a bias in recognizing and diagnosing the condition. This bias can result in missed diagnosis for females with autism. Another reason is diagnostic criteria. The diagnostic criteria for Autism Spectrum Disorder, ASD, were initially developed based on observations of males with the condition. Now, this means that the criteria might not fully capture the range of presentations seen in females with autism. These factors contribute to the underdiagnosis of autism in females and highlight the importance of considering gender-specific differences in the diagnosis and understanding of autism spectrum disorder. Traditionally, autism was considered a predominantly male condition, leading to a significant gender bias in research and diagnosis. For many decades, experts assumed that autism occurred more frequently in males than females, and most research studies focused on male participants. As a result, the understanding of autism was largely based on observations of males with the condition. This bias has had a profound impact on diagnosis, as boys have historically been referred for autism assessment and diagnosis at a much higher rate than girls. In fact, boys have been referred for autism diagnosis approximately 10 times more often than girls. Even today, physicians and researchers still have limited understanding of how autism presents in females because of the limited amount of data they have. The assessment tools and diagnostic criteria for autism were developed based on observations of males with the condition, creating a potential mismatch for females whose traits may not align with the traditional male-based understanding of autism. This means that identifying autism in females can be more challenging, as their trait may not fit the established male-centric profile of autism spectrum disorder. This gender bias in research and diagnosis has significant implications for understanding and addressing autism. It highlights the need for more inclusive research that considers the full spectrum of gender identities and presentations of autism, as well as the development of assessment tools and diagnostic criteria that are sensitive to the diverse ways in which autism may manifest across genders. Now, autism can look different in people, especially during childhood compared to male. Some key differences in how autism presents in girls include fewer social difficulties. Females with autism may report more sensory symptoms and fewer communication difficulties than males. They tend to be more socially motivated to form friendship and find ways to participate in conversations with others. Another point is internalized symptoms. This is very important. Girls with autism may respond to their condition internally, developing anxiety or depression, which may be perceived as shyness, a socially acceptable norm for girls, especially in the region of Asia and South Asia. This contrasts with boys who may exhibit more outwardly visible behavior such as restlessness or aggression, typically restricted interests like boys with autism. Girls may develop intensely focused interests, but these interests may align more with what other girls their age are interested in, such as hobbies or celebrities, making behavior less conspicuous. While autistic females may have better social and communication abilities in childhood compared to males. Studies show that they may experience more severe social and communication difficulties as they reach adolescence and adulthood. One significant challenge in diagnosing autism in females is that they tend to mask their symptoms. This means they consciously or unconsciously hide their autistic traits, often by mimicking socially acceptable behavior they observe in others. This masking can make it harder for family members, teachers, and healthcare professionals to recognize the signs of autism in females, leading to delayed diagnosis and support. The effort to mask their symptoms can also lead to mental exhaustion, stress, and anxiety for autistic females. Undiagnosed individuals assigned female at birth who have autism may experience years or even decades of feeling like something is wrong without knowing exactly what it is. They might learn to adapt and fit into what they perceive as socially acceptable behavior. But their autistic traits persist and can continue to pose challenges. Now, some signs of autism in adult females include social difficulties, like difficulty in reading and responding to social cues, leading to anxiety before and after social interaction, social situations, desire to be sociable but may struggle in group settings and to do better one-on-one, difficulty with eye contact, which can be challenging and uncomfortable, yet they may force themselves to maintain. Sensory sensitivity, heightened sensitivity to smell, light, sound, or touch, which can overwhelm their senses. Strong sensory sensitivities that may require them to remove themselves from triggering environments. Difficulty in sleeping due to sensory issues such as being disturbed by appearance, breathing, or light from an alarm clock, etc. etc. These challenges can significantly impact the daily lives of autistic females, affecting their social interaction, relationships, and overall their well-being. Autism, it's a very tricky thing. It can present several challenges for adults, especially in females when we're talking. Some of these challenges include difficulty with self-regulation and executive function, challenges in staying organized and completing tasks, particularly if the tasks are not interesting to them, issues with working memory, self-control and adaptability in thinking, which can impact their performance, especially at work or school or college or university, struggling with managing emotions and emotional control, which may lead to meltdowns involving crying or temper displays, intense interests. Females with autism may obsess over their interests, needing to know every detail. They may have a broader range of interests compared to autistic males who tend to focus on one subject. Preference for careers and hobbies that requires intense focus, repetitive behaviors just like males, but more intensely. Adoption of repetitive behavior such as stimming, self-stimulating behavior to self-regulate. This may include rocking, repeating words or phrases, and hand clapping. Refinement of repetitive behaviors in adulthood such as skin picking, pacing, or twirling hair, which may become more socially acceptable. Co-occurring condition. Now, development of other disorders over time. Even though autism itself is not degenerative, coexisting conditions are more common in people, especially if diagnosed later in life due to potential lack of childhood care and services. Possible co-occurring conditions include anxiety, ADHD, depression, eating disorder, obsessive compulsive disorder (OCD), sleep disorder, and tic disorder. These challenges can significantly impact the daily lives and well-being of autistic adult females, highlighting the importance of understanding and addressing their unique needs and experiences. Take care.